when someone walks in through the door, how does a traditional Chinese medicine expert such as you start the diagnosis process? Is it similar to Western medicine where they bring in a bunch of paperwork or run a bunch of blood reports, or what's your procedure?
That's a very good question. I think the approach a practitioner takes from any medicine has a huge impact on the results they're going to get with the patient. My particular approach, and one that many of us practitioners use, is an interview process that's extensive. I don't spend 10, 15 minutes with a patient when they come in. I spend a whole hour with the patient. I want to get to know you. I don't want to just get to know your symptom and put you in a category and treat you according to how most people in that category respond, because there's a person behind what you're feeling, and that person has a variety of experiences that they may or may not know contribute to that issue. What I want to know is who you are and what your personality is, in order to get a better sense of not how only I can treat that issue, but how our lives contribute to that issue and how our lives can be better in the future, so that you don't have to keep coming back for the rest of your life.
That's awesome.
So when I get a sense of who you are in my clinic, I start the Chinese medicine diagnosis, which starts with medical pulse diagnosis. Chinese medicine, especially the herbal portion, is very much directed at fixing organs that aren't receiving enough blood flow. Organs don't receive enough blood flow because of blockages, because of inflammation and swelling, vasoconstriction, which makes blood flow limited to an area. The body naturally does this because we have to survive, and prehistorically, when we had a chronic issue, the body would cut off blood supply to that area so that we wouldn't suffer sepsis, which is an infection throughout the entire body. These infections could be limited to a particular area. In modern medicine, our problems are not infectious normally, so the problem with limiting blood flow is really one of limiting the benefit of the body healing itself, because the healing components come with the blood. So if we can maximize blood flow, we maximize healing. That's huge. And if there is an infection, we have ways of dealing with that we know now that our bodies didn't know then.